Welcome to our very first Moving with MS support group of 2024. It truly feels like last week where we were having our December call. So time is already flying by, but I hope everyone had a lovely holiday season. And we're just going to dive right into it. This topic was purposely chosen for January because the topic is neuroplasticity. And we've talked about neuroplasticity before. This is one of the topics that I think is the most important and is truly the foundation for MS-specific exercising. So today we're talking a bit about neuroplasticity alongside MS-specific physical therapy and exercise. Without understanding this information, it can be very likely that you do I'll say the wrong type of exercise. Now, all exercise is great, don't get me wrong, but it depends on what your goals are, and we'll get more into this today. But if you feel like you've been exercising, and you're getting stronger from your exercises, but your day-to-day life isn't any easier. Your stair climbing is still just as hard. You're still tripping just as much. These goals that you have are still happening, then you're not implementing the right type of exercise. So we're going to get into all of that today. Again, this is our Moving with MS virtual support group. You probably know that because you willingly logged in today. But thank you so much for being here. We really appreciate it. And a huge thank you to our supporter, Viatris. So we're discussing neuroplasticity and MS-specific physical therapy. And the reason why I think it's important to differentiate MS-specific physical therapy is because, as you may know, and you can let me know in the chat box if you've experienced this, but regular or traditional or orthopedic physical therapy is very different from MS-specific physical therapy. So we're going to get into the why from that. But I like to have this included in our neuroplasticity webinar, because if you are someone who has experienced that before, you've been to an orthopedic physical therapist and you didn't see the results you were hoping for, you might assume that physical therapy doesn't work for you. Or you might assume that exercise in general just won't help because you have a progressive disease of MS. And fortunately, those things are untrue. And the reason that you likely didn't see results before was because it wasn't with an MS-specific approach. Now, of course, everyone who has MS is different. All the symptoms are different. The progression is different. And sometimes the disease will progress anyways. But exercise with an MS-specific approach has been proven in MS research to actually slow the progression of MS and actually help you improve functional gains like your walking, your strength, your balance, etc. Okay, there we go. So we're going to be discussing neuroplasticity, the different types of physical therapy. We're going to do a few exercise demonstrations and guidelines, and then talking about how to get access to an MS specialized physical therapist. Okay, so neuroplasticity has a few different ways of working, and I recently found this photo, and I think it's just a great example of the different ways that it works. So all the way over at the left, you'll see that what is neuroplasticity, aka brain plasticity, it's the brain's ability to change and adapt. And we often think of this as kids. And if you don't know, I am actually 31 weeks pregnant now. And it's so interesting because I'm using an app to track the pregnancy and what's happening during each week. And it's so interesting because more recently, I think it started around week 28 or 29, the app was saying that the neural pathways and the myelin is starting to form in the baby's brain. And it's just such a different approach to thinking about neuroplasticity with adults. Neuroplasticity is the brain's ability to create change, and adapt. So in kids, in babies, it's the ability for them to keep falling down when they're attempting to walk, but learning how to walk eventually. And then that turns into learning how to run. Or if you've ever seen a toddler playing a game, and initially, even like something like Legos, or they're playing with blocks, initially they don't understand how it works, but after playing with it, they are able to understand how it works. Or maybe one year they're unable to play a game, but then the next year they can, or even a few weeks later they can. That is neuroplasticity. It's the ability of our brain to create these neural pathways, change our neural pathways, and adapt to different situations. So it can be easier to understand that as a kid because we expect them to grow and learn new things, but it's also possible for adults. So if we move towards the middle and then in the right side of this photo, you'll see that type 1 of neuroplasticity is structural plasticity. And what this means is that it's the brain's ability to change, create, and adapt based on experiences or memories. So this is the prime example of when we're kids, or even as adults or high schoolers, if we're ever trying to learn a new language or learn a new hobby or a skill, we're experiencing that hobby and skill over and over and over again. And eventually our brain will find neural pathways that make it work, or also memories it can work with too. Type 2 is functional plasticity. So this is the brain's ability to change, create, and adapt, and specifically move from a damaged area to an undamaged area. So I'm actually going to stop sharing the screen for a second just so I can give a little demonstration here. So I want to demonstrate from a standing position how neuroplasticity works with functional plasticity. So it's the type 2 plasticity, because this is the type of the type of neuroplasticity that applies for people with multiple sclerosis, because the reason that you have difficulty with walking and moving, climbing stairs, getting up from the ground, and weakness is because the neural pathways leading from your brain all the way down to every muscle in our body are damaged due to myelin deterioration. But neuroplasticity is the ability to find a different way, to go from this damaged area to maybe trying this area. So I want to give you a little demonstration. So I'm going to back up for a second here. Okay, so picture, so you can see me standing. So let's say one movement that's really challenging for you to do is marching, is lifting your leg up. This is a very typical movement that's hard to do, but it's necessary. We need to be able to lift our leg up in order to take a step forward, in order to take a step up on stairs. So very, very important movement. So if lifting my leg like this is hard for me to do, let's say I can't actually do it at all. Let's say I'm trying to lift it, and with every attempt, it's just not lifting at all. What that means is that the neural pathway, let's just say the neural pathway starts here in the brain, then it travels down my spinal cord and through neural pathways and comes all the way down to my hip flexors. That neural pathway clearly is not working, because when I attempt to lift my leg, nothing is happening. So with the information you'll learn today, you'll learn how neuroplasticity has the ability to find a new neural pathway. Instead of just going this same path over and over again with every attempt, your brain has the ability to find new neural pathways, a new way to get from point A to point B. Might be some zigzags, might be some swirlies, it might go all the way around. There's trillions of different ways to get from point A to point B. So that's what will happen if you go to move any muscle. It could even be your arm. If you go to bend your elbow like this and nothing happens, your brain, when you keep practicing the exercise, is going to try to find a new way to get to your elbow flexors. If you go to do a movement like marching and you are able to move the leg, but it's very hard. It's very cumbersome. It's very hard for you to lift. It doesn't lift as high as the other side, which might be your better side. What that means is that your neural pathway, starting at point A down to point B, is actually there and it's working. It just needs to be strengthened. So in this case, we're kind of going more towards type 1 of neuroplasticity. Type 2 is the ability to go from a damaged area to an undamaged area. Type 1 is neuroplasticity based on repetition and based on experiences over and over again, repeatedly. So by repeating the movements over and over again, and a few other tactics you'll learn today, you'll be able to actually strengthen that neural pathway that's already there. So to recap, neuroplasticity typically occurs in two different ways. Option 1, it can reroute itself. If you try to move something and it doesn't move, that's okay. Your brain has the ability to reroute itself, rewire itself, so that you can actually see improvements in your strength. Or if you have some strength, it's just weaker due to your MS, your brain has the ability to strengthen that neural pathway that's already there but has been weakened. And your brain can absolutely do both. For some people, you're going to be doing both. Every single muscle group is different. So for your hip, you might be creating a new neural pathway. For your knee and ankle, you might be strengthening the neural pathway that already exists. So it's a little bit different for each person, but those are the ways that neuroplasticity can work. Okay, another thing that is important to know that coincides with neuroplasticity is BDNF. BDNF is the brain-derived neurotropic factor. So this is a protein that is released in our bodies and in our brain when we exercise, when we move. And this protein is really important because it supports the survival of the existing neural pathways and neurons, and it encourages growth of the new neural pathways, new neurons, new synapses. So it supports neuroplasticity. So the more BDNF we have in our brains and our bodies, the more likely we are to see actual improvements in neuroplasticity, and the more likely neuroplasticity will occur at a quicker rate. A side note, but also important, is that BDNF, this protein we're talking about, can also show improvements in cognition, depression, and anxiety. One cool thing about BDNF, because you might hear that this protein helps with neuroplasticity, helps with growth of new neurons and supports current neurons. And you might be thinking, well, I might have to exercise for hours and hours in order to get this. Not the case. There's research showing that exercising for just 20 minutes at a low to moderate level of intensity is enough to get BDNF to release in your brain and body. So it doesn't need to be something that is an hour-long exercise or even 40 minutes. All it takes to release BDNF is 20 minutes of exercise. And this also can reduce the body's inflammatory response. And I just thought this was an interesting fact. I'm all about research, if you don't know that about me. I think it's really exciting and interesting just to hear what evidence is out there, specifically in the world of multiple sclerosis. So when it comes to neuroplasticity, there's actual evidence showing that people with multiple sclerosis who exercised consistently had different MRI results than those that didn't exercise at all. In particular, it showed that those that did exercise consistently had less damage in the parts of their brain that had deterioration from a relapse. Those that exercised consistently had improved recovery from an MS attack or relapse or exacerbation. And those that exercised consistently had reduced long-term disability. So for me, I see those things and I see that it's not exercise will not only help you feel better and move better, but your brain actually is responding to it. So implementing the things that we talk about today will actually change your brain for the better. Okay, so this is a very important slide, so much so that I'm going to repeat it again later on, but how to activate neuroplasticity. Because one thing that you can do that you may have pieced together already, or maybe you've heard me talk about before, is repetition. So I mentioned earlier when I was doing the demonstration that if you're trying to lift your leg and it's either not lifting or it is lifting but not as much as your stronger side, then one way you can find that way to reroute itself, to rewire, or to strengthen the neural pathway is to repeat the movement over and over again. And eventually your brain will strengthen or rewire itself. But there are other things that you can do as well, in addition to high amounts of repetition. So these are the other things that you can do. Number one, cardio before your strengthening exercises. And to be more specific, cardio before functional exercise, before your MS specific exercise, and we'll get into that. Number two is focused attention. And so this means that as you're doing your exercise, you are focusing on that exercise. You're not thinking about what you're going to have for dinner later. You're not thinking about what you're going to get at the grocery store this week, or that you forgot to call your sister again. You're focusing on the exercise at hand. Another thing is alertness. The more you're alert, the more likely you are to promote and activate neuroplasticity. So if you're just kind of lazily sitting back, reclined, maybe you're even watching TV at the same time and you're doing your exercises, you're less likely to promote neuroplasticity. You absolutely can do exercises in front of the TV. That can be great for other reasons and doing two things at once. But when it comes to neuroplasticity and activating it, you really want to be focused and alert with what you're doing in that moment. The next is urgency or challenge. And so think about how you can create some urgency in the exercise. Even for the exercise I was demonstrating earlier, like the standing marching, lifting my leg, I could make that urgent by trying to do a certain number of them within a certain number of seconds. Or even more fun, try to do a certain number of those as I'm listening to the chorus of my favorite song. And maybe I try to do 20 marches by the time the chorus ends. So you're creating some level of challenge or urgency. Next up is novelty. You want to do new things. You don't just want to always do the same exercises in the same order every single time. There's research that shows that doing things out of order and doing exercises in different ways is a way to promote neuroplasticity. And then lastly is salient. This is a great one to not only improve neuroplasticity in terms of how do I want to phrase this? It's not only great to promote neuroplasticity when it comes to exercise, but it's also great because it can remind you of your why, of why you're exercising in the first place. So salience means make it important to you. If you're doing that standing marching exercise I demonstrated earlier, and you're thinking to yourself, this is so boring, I'm not enjoying this, I'm only doing this because Dr. Gretchen told me to, that has zero salience. It doesn't mean anything to you. But if instead, as you're doing that exercise, seated or standing, you're telling yourself, this exercise is going to help me walk better. This exercise is going to help me climb stairs. Or make it even more meaningful. This exercise is going to help me go on walks with my grandkids. This exercise is going to help me walk from my house to my car so that I can drive to go see my friend. Make it meaningful to you. What will each exercise do for you? I see a question that just came in saying, so if I cannot move something, how do I know if I am creating new pathways? Just keep on thinking hard to move. That's a really great question. So if you're in the situation where you try to move something, your ankle, your knee, hip, anything, and it doesn't move, or even if it does, my answer would be the same. How do you know if you're creating a new pathway and or strengthening the current pathway? The tough love answer is you won't really know until you've been doing the exercise for a long period of time. And we're about to get into a few questions about neuroplasticity that will answer this too, but you keep repeating, and we'll get into more on this today, but you keep repeating certain exercises, you implement these ways to activate neuroplasticity, and there's other things that you can do as well. And by doing that over and over and over again, that is how you get neuroplasticity to work, to find those new neural pathways and to strengthen. The way that you'll know that it's working is that eventually you will notice that you do see some movement. And it might be a centimeter, it might be the smallest amount of movement, but you'll see it or you'll feel it. And that might be after just a few days of doing the exercises. It could be after a few weeks, a few months. It could be after a year and a half, 2 years. And if you're on that later end where it does take a year and a half, 2 years, it takes so much consistency, so much determination and understanding of neuroplasticity to keep believing that this is possible and it is happening. Because the unfortunate thing about neuroplasticity is that we can't see it happening. If only we had some type of imaging at home, like if we could put our phone up to our brain and kind of look at it as we're exercising and you'd see these pathways lit up, how amazing would that be? Because we would know, like, okay, my leg's not moving, but it's working. I see my brain firing. How much more motivating would that be? But unfortunately, we don't have that technology, at least not yet. How does urgency and challenge go with low, moderate intensity? Yeah, so I mean, you're in the same example that I provided earlier, choosing a lower number. So if you're trying to do a seated marching exercise, which is just sitting, lifting your leg up and then down, if your favorite song has a chorus that is 30 seconds long, that's probably really long, let's just say it's 30 seconds, or maybe you set a timer for 30 seconds, maybe your goal is to do 3 repetitions in 30 seconds by the time that chorus is up or by the time your timer ends. That's low intensity. You do not have to be shooting for high numbers, but you do want to be shooting for something that's a little bit challenging for you. If 3 repetitions is easy for you to do in that amount of time, it's not going to feel like a challenge. Another example could be balance exercises. So balance creates challenge and it creates urgency. Another thing, I don't know if you guys know of the Wii Fit. It is it's a game that you can play at home and you stand on this board. It's not a balance board or anything, but it has sensors in it and it connects to a game that you play on your TV. And there's a bunch of different games that add some challenge and urgency, and you're working on balance at the same time. Very low intensity, but a way to implement challenge and urgency. Another thing too, that I forgot to mention on this slide, I'll say it now because I can't remember if it's on another slide, would be that you can implement these things, was not the cardio, but these 5 under here, you can implement those between your exercises. It doesn't have to be in the actual exercise. It can be, but it also could be that during your rest break, you are doing something that creates challenge and urgency. One thing that I love to do for that is the Bop It. I don't know if you know what that is. It's a kid's toy. And it's really great for urgency because it tells you what to do. It tells you to bop this button, spin something, pull something, twist, pull, or what's the other one? There's another one. I have to sneeze. Hold on one second. Maybe it'll go away. It feels like it's right about to come out. So it tells you what to do on the toy, and if you do the wrong thing, you lose the game. And not only that, but there's music playing in the background, and so there's urgency. It speeds up the better you do. So you could do that while you're resting. So it doesn't always have to be with the actual exercise. Rena says that would be trying the same thing over and over, or changing how to do it, or mixing it up. I'm not sure exactly when you asked that question, so I don't know exactly what part you're referring to. When it comes to repetition, and we'll get into this a little bit later too, but doing the same exercise over and over can be very helpful, but you also want to switch it up. So for example, if you have a routine where you're doing 5 exercises, you would not want to do all 5 in the same row, in the same order every single time. You'd want to switch it up. Maybe you start at the end and go forward, or maybe you start in the middle and switch that up. So it's similar exercises, but not in the same order. Or one of my favorite examples, that marching exercise that I did, the standing and lifting your leg, or seated and lifting your leg, can be done as you're just sitting down, as we're talking together right now. But one thing that we have in my online MS wellness program is monthly seated dance classes. And I love them because our teacher plays music. She's a ballroom dancer, so she plays music and she teaches us a dance to this music, and it's ballroom dance themed. And there's so many functional exercises in there. There's so many marches in there, but in a different way than just sitting and marching your leg. And so it allows you to use your hip flexors in a different way. So it's a little bit of all of that. I have tears. Thank you for explaining this so clearly. I used to be a marathon runner, fitness instructor, etc., and I believe that's what kept my MS at bay. Yeah, even though it was progressing clinically for so many years. Now movement is difficult. I do some of the exercises and I am exhausted. Point being, thank you. You're very welcome. Oh, I love that. Okay. Moving on. So let me just do a time check here. Okay, so these are just some very typical questions that I receive about neuroplasticity. How long does it take? As I mentioned earlier, we don't know. Unfortunately, it is different for every person, but we do know that it takes a different amount of time based on certain things, and we'll get into those in a second here. But it could take anywhere from a few days to a few weeks, a few months, a few years. So there's no one size fits all, but the only way to find those new neural pathways and to strengthen the new neural pathways or old neural pathways is to start now. It's never too late to start. The only way is to start implementing things consistently now, as soon as possible. Does it matter how old I am? No, there's research showing that neuroplasticity occurs in all ages. With that said, the older we get, the longer it takes. So I'm sure you've heard the phrase, you can't teach an old dog new tricks. You can teach an old dog new tricks. It just takes longer. I feel like kids these days, or even millennials, understand technology so much better than baby boomers, just because we were younger when it came around. We were able to learn it so much faster. So the younger you are, the quicker it will likely occur for you. But research shows any age is possible. Does it matter how long I've had MS? No. Research shows that neuroplasticity occurs in everyone, not just people who have only had MS for 1 year or 5 years. With that said, the more disability you have or the longer you've had MS, potentially that could make the rate of improvement slower. But again, it's still very possible. Does it matter what type of MS I have? No, it does not. You could have relapsing MS, primary progressive, secondary progressive, any type of MS, neuroplasticity can occur. Oh, I saw another question. Does neuroplasticity also help with extremity heaviness? Great question. Heaviness oftentimes is either due to fatigue and or spasticity. Most of the time it's spasticity, and neuroplasticity might help with spasticity, but neuroplasticity mostly helps with strengthening. We have had other topics, and throughout this year we'll repeat some of them on spasticity and fatigue. Let me, once I'm not sharing my presentation anymore, I'll share the link with you where you can get the recordings of our past presentations to learn a bit about those. Does neuroplasticity work when most of your lesions are in your spine instead of your brain? Great question, because we don't know the answer to this yet. So there's tons and tons of research, which is what I'm sharing with you today, about the benefits of neuroplasticity for brain lesions. But there's little to no research about neuroplasticity for spine lesions. With that said, I have been trying, this is like one of the questions that I've been trying to discover for the last 8 or so years is this exact question, which is, does it work for spinal lesions? So I have asked tons of MS neurologists, MS researchers at every conference I go to, I'm asking this question. And the general consensus that almost everyone says, neurologists, researchers, you name it, is we don't know, but the thought is it can't hurt. It's not going to cause any further damage. So the options are, if you have spinal lesions, implement these strategies anyways, and hopefully you'll see an improvement. But the worst case scenario is you'll at least maintain. That you won't see as quick of a regression, because at the end of the day, it's still exercise which has been proven with brain and spinal lesions to slow the progression of MS. So there's really no downside. So while there's not any research yet saying, yes, it works for spinal lesions too, just as well as brain lesions, while we don't have that research yet, the general consensus is it has every possibility of also showing similar improvements. So implement anyways, as if it will. And I will just say anecdotally, I have so many Missing Link members where this question has come up, and a ton of them will say, I have spinal lesions and I've noticed great improvements in XYZ in different areas. So there's a lot of, and if you're on this call and if you have spinal lesions and have noticed improvements, type it in the chat and I can share your story. So I hope that answers your questions. Long story short, we technically don't know. General consensus is yes, it can help. Why not try? Worst case is you at least maintain your current level. And just anecdotally, yes, a lot of my clients with spinal lesions still notice improvements. I started doing a beginner's ballet leg routine on DVD, and I follow along with the moves while concentrating on telling my left leg, which is the weaker leg, to raise and lower. Would this help create new pathways? Yeah, that's one way. So it sounds like you're doing the ballet leg routine. That's a different way of getting in some functional exercise. And you're focusing on it, which is good. In a few slides here, I'll be getting into more specifics, and I think that'll answer your question too. All right, so what type of exercise and or physical therapy should you be doing to promote neuroplasticity? One that focuses on strengthening your muscles and your neural pathways. So if you've ever been that person where you felt like you were exercising and you did get stronger, but your function wasn't any easier, or walking wasn't any easier, stair climbing wasn't any easier, or if you were exercising and you didn't notice that you improved any strength or balance or whatever you were working on, in either of those situations, the most likely reason is that you weren't doing the right type of exercise. You may have been focusing on exercises that were just strengthening the muscles, not the muscles and the neural pathways. So I put this picture together a few years ago and I absolutely love it. I think it's such, obviously I'm biased, but I think it's such a good visual of what needs to happen for a muscle to move. So the first thing that needs to happen is our brain needs to fire. Our brain needs to say, I'm going to pick someone's name, Emma. Our brain needs to say, Emma, lift your leg. Then as soon as you have that thought, that message of lifting your leg travels down your neural pathway. So this is a picture of a nerve. So it travels down all these neural pathways connecting one to another, and then your leg will lift. So then your muscle moves. A lot of people forget about this middle step. If you could put your hand on the screen over that middle step, a lot of people think it just goes from your brain to your muscle. You just think, lift my leg, and then your muscle lifts your leg. That's not the case in anyone. But the reason this is important to understand the steps is because when you have MS, issue that's causing weakness isn't in the muscle. The weakness, the reason that you have the weakness is in the neural pathway. It's in this second step right here. So do we want to strengthen your muscles? Absolutely. That is definitely the end goal. But we have to do that by strengthening the neural pathways through neuroplasticity. So it's a different way of exercising, and you want to focus on strengthening the neural pathways and the muscles, the Hulk, not just the muscles. So what type of PT focuses on strengthening the neural pathways? First and foremost, the MS-specific physical therapist or MS certified specialist, MSCS. So that's what I am. I will say there's not many of us, unfortunately, that exist. So we are physical therapists, usually doctor to physical therapists with the MSCS certification. If you can't find one of those near you, the next best would be a neuro certified specialist or NCS. So this is someone who is specialized in treating all neurological conditions. So it's not as great as the MSCS because the MSCS, the thing that we are specialized in is multiple sclerosis specifically, whereas neurological diagnoses in general, some of them are demyelinating diseases like MS, but some of them have nothing to do with the myelin sheaths and demyelinating, meaning it's a different approach, but it's still better than an orthopedic physical therapist, which is who you would go to if you injured yourself, if you had a fall, if you needed surgery, then physical therapy. That's more of an orthopedic PT. So if you're going to PT, for MS, you really want to focus on one of these two. Number one would be best because it's specialized in MS. Number two is second best because they're specialized in neuro conditions. Physical therapy helps with so many things. I don't even know where to start, but this is just a very small list that I put together that will let you know certain things that physical therapy can help with, because we tend to think of physical therapy to help with strength and balance and aerobic endurance, which is absolutely possible. But it can also help with spasticity. It can help with fatigue. And we have another webinar that we've done on fatigue, but it can help with your fatigue. It can help with depression, walking performance, quality of life. It can help with so many symptoms, ones that aren't even on here, sensation. It can help if you have numbness, tingling, burning, or pins and needles. It can help with stamina. It can help with so many different things. A general physical therapist, aka orthopedic physical therapist, or basically if you were to call a clinic in your area that's not an MS clinic, they're probably an orthopedic physical therapy clinic. So the education that they have generally are 6 to 7 years of schooling. Currently, there's still some physical therapists out there, depending on when they graduated, where they have their master's in physical therapy, but for about 20 years now, I want to say, it's been a doctorate level program. So if you are working with a physical therapist, even an orthopedic physical therapist that has graduated within the last maybe 15, 20 years, they likely have their doctorate degree, which is 6 to 7 years of schooling, and they've passed the National Physical Therapy exam. Their general focus is general strengthening, general balance and walking, reducing pain. Typically, they do push you to the point of fatigue. They want you to kind of max out and go big or go home. And they're focusing on strengthening the muscle piece. So if you pictured that image of the brain neural pathway Hulk for the muscle, they focus on the Hulk. They focus on getting your muscles to get stronger, to get better balance. Exercise examples. So, and you'll know this if you've been to an orthopedic physical therapist, some of these will sound very familiar. Straight leg raise, side lying leg raise, clamshell, squats, bridging, lunges. These are all really good exercises, but they're not functional, meaning you could get full strength in these exercises, but most of these are lying down or seated exercises. You might go to stand up and utilize that strength, and it's non-existent. Because when you have MS, your brain and neural pathways don't have the same carryover, meaning you might have full strength here, but then you don't notice that strength when you're walking because you didn't practice the exercises when you were walking or in a standing position. Whereas MS-specific physical therapists, so the MSCS, the MS Certified Specialist, they still have their doctorate degree, the 6 to 7 years of schooling. They still pass the National Physical Therapy exam, but they also pass the MS Certification Specialization exam. And not only that, but every 5 years, they're required to have at least 75 hours of continuing education and of learning activities is what it's called, showing that you are staying up to date on MS research, since there's so much that changes every year, even every 6 months. The focus here is functional strengthening, MS-specific muscle strengthening, because MS tends to attack specific muscles and specific muscle groups. So we want to focus on finding those ones and strengthening those first and foremost. Balance and walking, of course, neuroplasticity, and then neuro recovery and compensation, because as I mentioned earlier, it might take a while for neuroplasticity to kick in, meaning you might feel like it's taking a year or 6 months for your muscles to start to notice some improvement from the exercises. Well, I don't want you to wait 6 months or a year to actually start using that muscle in real life. So in the meantime, we can help with compensating. How can you compensate in real life situations so that you can still get from point A to point B quickly? For example, if you are working on bending your knee more when walking, neuro recovery would mean exercises to help you with bending your knee, but compensation might mean using a rollator when you're in your home so that you can get to the bathroom as quickly as possible so that you don't pee your pants. So we can compensate with some strategies too. And then lastly, MS-specific physical therapy takes the most common MS symptoms into consideration. We'll never push you to the point of fatigue. That is not going to be helpful for people with MS. We look at heat intolerance and making sure you're staying cool, because if any symptoms flare, it might just be because your core temperature raised. We look at your fatigue, your sensation, your vision. So we look at more of the whole body and what could be contributing to your symptoms versus just the hulk, just the muscle. So the main way that exercises are different for MS-specific physical therapy is that they are functional. So the way to think about functional exercise is it's based on the activities that are hard for you to do. So one of my favorite examples, if you've been on these before, you've probably seen me do this. This is my favorite example of all time. So what is functional exercise? It means taking one of your goals or taking a thing that's hard for you to do and then breaking it down into as many movements as possible. So as you can see, walking is this whole 0 to 100 right here. So 0 to 60, meaning 60% of your walking is in stance phase, meaning both feet are in some way, shape, or form on the ground. Whereas swing phase, so 60 to 100, so 40% of your walking, you're swinging. So one leg is off the ground for 40% of your walking. And that means that there's a lot of movements that need to occur to get from 0 to 100. It's not just one quick movement. So I'm going to stop sharing my screen here to demonstrate something. So I'm going to demonstrate walking just to show, I think this is a perfect example of what functional exercise is. So in this example, we're taking the thing that's hard, which is walking. Let's say I have a goal of walking to be easier. I want to walk longer distances. I want to be able to walk without tripping, better quality, you name it. Let's take walking and break it down into as many movements as possible. So we're thinking, what movements are required for me to take a step forward? So we're going to do that together. So to take a step forward, if we're watching this leg, For me to take a step forward, I need to be able to shift my body weight forward, bend my knee, swoop my toes up, bring my knee up, straighten my knee, put my heel down, and all while that leg was doing that, this leg was single leg stance. So it was standing on one leg. So that's 7 things. I'll repeat that one more time. You'll get the recording to this. So if you don't get it, no worries, you'll get the recording. So these are the 7 steps that it takes to take a single step forward. Number 1, shift your weight forward. Number 2, bend your knee. 3, swoop the toes up. 4, knee comes up. 5, straighten the knee. 6, heel comes down. 7, stand on one leg. And then guess what? That was just one side. Then we need to do all of those 7 things on this other leg. So what functional exercise means is that we take those 7 movements that are required to take a single step forward, which is our goal, and those 7 movements are now our exercises. If some of those are easy, we don't have to include them, but any of the ones that are really challenging, we definitely want to include in our exercise routine. So I'll give you one example. I'll stick with the example I gave earlier. So step 3, right, let me think, 1, 2, no, step 4 was marching. It was bringing my knee up towards the ceiling, meaning one exercise that we could do that's very functional is standing marching. If that's too hard, we can do seated marching. If that's too hard, we can recline backwards and march. So there's lots of different ways to march, but that is a very functional exercise because, as you saw, marching is one of the steps required to take a step forward. Another example would be that first one, shifting your weight forward. This was step number 1. So practicing getting your weight forward and then back and then forward and then back, that's an exercise. So you would take each of those 7 steps, 7 movements, and those movements are now your exercises. That's what it means to do functional exercise. And that's one of the best ways to get neuroplasticity to work, in this sense that you're not just gaining strength in the neural pathway and muscle, but you're utilizing that strength in activities so that you're actually seeing an improvement in your day-to-day life, not just I'm stronger, but I'm not walking any better. Debbie asked a question, is there a directory to find an MS certified PT? Yes, I actually have that coming up in a few slides. So newest guidelines for exercising to get neuroplasticity to work, and one is on the next slide. It's a repeat of that slide that I mentioned earlier. So we'll get to that next. But in addition to that, it's functional exercise. So much research shows how important functional exercise is, specifically for people with multiple sclerosis. And I don't know if it's just the new year, but I had about 3 people message me in the last week, message me on social media saying, check out this article. It's all about how important functional exercise is. And so I don't know if it's just a buzzword right now and more people are talking about it, but functional exercise has always been the best for people with MS and just people who have goals to improve function, improve day-to-day exercises. But because it's not talked about frequently, we think that just doing any old exercise is good for us, which it is, but it's often not going to help with goals. It has to be goal-oriented. So functional exercise for sure. Number 3, almost perfect quality. Our brain remembers what we're doing more of. So if you're having poor quality with your exercises, with your movements, then your brain thinks that's right because you keep doing it over and over again. And if you remember with neuroplasticity, our brain will strengthen or find new neural pathways based on repetition, based on what we're doing over and over and over again. So if you have bad quality, not only can that result in things like tripping and falling, but your brain thinks it's right and it's going to create and strengthen that neural pathway, which we don't want. So making sure that you have almost perfect quality. High repetitions, if you practice 50 repetitions within one day, it doesn't have to be all at once. If you practice 50 marches, 5 here, 5 there, 5 there, that means your brain had 50 opportunities to find or strengthen a neural pathway. If you only did 5 that day, your brain had 5 opportunities to find or strengthen neural pathways. So the more repetitions, the more opportunities for neuroplasticity. And what you might be thinking right now after hearing that you should be shooting for almost perfect quality and high repetitions is, holy cow, that sounds fatiguing. The final one is rest breaks. Take lots of rest breaks. These do not need to be done all at once. In fact, the more rest breaks you take, the more likely you are to be able to do more repetitions and more perfect quality. Here was the slide that I shared earlier. So it's just a repeat of the 6 ways to activate neuroplasticity. So it's everything on this slide in addition to this slide to get neuroplasticity to work and see the most success in your exercise routine. So the cardio first has been shown to prime your brain for neuroplasticity, focused attention, alertness, urgency, novelty, and salience. Okay, and then I think this might be the last slide, and it's perfect because Debbie just asked about this. So how to get access to an in-person or virtual therapist, physical therapist who knows about multiple sclerosis, who is an MS certified specialist. Fortunately, there's several different ways. One way is to reach out to the MS Society. They have something called a care partner, or it might be called partner in care. It's something like that. And that is usually a clinic that has MS certified specialists there. The only downside to the MS Society's Care Partner program is that it doesn't include every physical therapist that has an MS certified specialty, because you have to be part of a clinic or a facility that meets certain needs. So for example, I was an MS certified specialist in Boston for about 3 or 4 years before I became an MS care partner through the MS Society. I was still there, still existed, but if you only went to the MS Society, you wouldn't have found me. So it's a great place to start, see who's in your area. But if you don't see anyone near you, don't fear. That doesn't mean that there aren't any that exist. So the next one would be the Consortium of MS Centers. This is where physical therapists get certified for the MS certified specialty. And so they do have a resource on their website where you can find a physical therapist that has a specialty. And then lastly, call your local PT clinics. The only thing you want to be careful of is that if you call and you say, hey, do you have someone that specializes in MS? They might say, yeah, we have a physical therapist that works with people with MS. You need to ask, do they have additional certification, or do they have additional education on multiple sclerosis? Because working with people that have MS doesn't necessarily mean that you know MS, that you know neuroplasticity and functional exercise. So just make sure that you ask those questions. Next up of getting access is telehealth physical therapy. You might find an MS care partner from the MS Society in your state, but they're hours away from you. In-person physical therapy is great and often best, but if it's not feasible, see if they offer telehealth physical therapy. They might, and that might be one way that you can work with someone who specializes in MS. And then the last option, this is the missing link. It's my resource that I have. So I have an online wellness program, which is going to be the best option if you're looking for not just the exercises from physical therapy to do, but also want to be able to ask me questions, or I even bring in MS experts like neurologists, and you can ask them your questions. So it's a more personalized touch. But as you might be able to see behind me, I also have a book, I have a podcast, I have lots of ways that you can learn MS-specific physical therapy through the missing link. Okay, so I do see some questions came in. I'll go back through those, but these are the different ways you can reach out if you do have questions or ideas for different moving with MS support group conversations. You can let me know at my email here. Missinglink.com is where you can find all of my resources and ways to work with me. I have a Facebook group, Instagram, podcast, YouTube, and my book as well, which is right behind me. Oh, 8 on the dot. We really take it right to the end here. Not too many questions that came in. Oh, Debbie says your pregnancy is beautiful. I missed December, so this is super exciting. Oh, thank you, Debbie. Lynn, when I walk, I think of the 7 steps. Awesome. What about finding a trainer with MS knowledge? Yep. By trainer, if you mean a personal trainer, not a physical therapist. So if you don't know, physical therapist is very different from personal training. I had a super eye-opening experience when I was a physical therapist. I was a newer physical therapist, and I had to give a training on, it was something orthopedic. It wasn't related to MS, but I had to give a training to the personal trainers who worked in the same facility as us as to different conditions that you might want to avoid certain exercises with when it comes to back pain versus which ones are okay. And I honestly felt so silly for giving this presentation because I was a newer physical therapist. These were seasoned personal trainers. But what I was educating them on, which was basically like big, obvious no-nos of you would not want to do these types of exercises with patients who have these types of conditions. They had never heard that information before. And they were writing notes down like crazy. And it was just like super eye-opening, like, oh my gosh, you've been working with people who have back conditions for years and you didn't know this? Like, what exercises were you giving them that may have actually been doing more harm than good? So anyways, personal trainers have a very different education and background than physical therapists. When it comes to finding a personal trainer with knowledge about MS, I actually don't have any resources off the top of my head for that. Again, that might be a situation where you call your local gyms and see if they do have anyone with experience. Kanita says, step 2, lifting foot in back. If I can't lift my foot without falling over, how do I keep from falling? Yeah, so with step number 2, if you can't lift your foot without falling over, you can do it seated. So remember that with all those 7 steps, of course, the most functional position, and we have a different topic, I can't remember exactly what month it is yet, but we have a different topic on functional exercise, but the most functional position would be standing because that's going to be, the position that you are actually walking in. But if that's too challenging, you can always do it seated or maybe lying on your side or lying on your back, lying on your stomach. There's so many different positions that you can exercise in to improve safety and once you're stronger there, then you can do it standing. So if it's too hard standing, I would say do it sitting, and it's the same thing. You just bend your knee in a seated position. Can I hold my walker while doing the exercise, the marching exercise? Absolutely. You can hold your walker or anything that feels stationary to you during any standing exercise. Yes. Julie says, congratulations. Thank you, Julie. Awesome. Any other questions before we pop off? I know we went a few minutes over, but any questions, comments, thoughts? A huge thank you. You're very welcome. I'm so glad this was helpful. Holding walker changes balance. Yeah, so holding a walker, the reason why I like holding a walker when or trekking poles, anything when you're standing is because it allows you to focus more on the strengthening component than the balance component. And it depends what your focus is. If your focus is balance, then you might not want to hold on to something or hold on much lighter. With our topic today, we're focusing more on strengthening. So holding on to something is smart because then you don't have to worry about balance and strength. We're taking balance out of the equation. Your balance is good because you're holding on to something so that you can focus more on the strengthening component. This was a helpful reminder. Awesome. March 12th is my son's birthday. What if you can't move your hand or fingers? So everything we talked about today with neuroplasticity applies for your hands and fingers and upper body as well. So same thing. My answer, what if you can't move your hands or fingers? I would say still the same concepts. Neuroplasticity still applies. You can still strengthen those neural pathways or find new neural pathways. Obviously, it would be with hand and finger exercises, not with leg exercises. And I think we have something coming up in 2024 for more hand, finger, and upper body. But yeah, it would still apply. My birthday is March 11th. That's awesome, Michelle. Thank you for everything as always. You're very welcome, Mary Lou. Are there links for arm exercises with neuroplasticity? Let me share. I wanted to share this with you guys. This is the link. I'm going to share it in a second here, where you can go to MS Views and News. Send to all. Hopefully you all just received it. Where you can go to MS Views and News YouTube page, and it's specifically a playlist with all of our past recordings. I can't remember if we have had the arm exercises in the past or if it's going to be a brand new one this year. So if you don't see one there, it is coming. Just know that. Peggy says, thank you. You look great. So happy for you. Thank you so much, Peggy. Awesome. All right. Well, thanks so much for staying with me, especially because we're a few minutes over. Have a great rest of your month, really, now that we do these monthly. I will see you next month. And if you need anything in the meantime, you have all those resources that I shared with you as well. So have a great rest of your day, great rest of your month, and I will talk to you guys soon. Bye, everyone.